I'm Mike Robertello. I'm one of the cardiologists here at Rutland Regional Medical Center. I've been here about 20 years. I started getting interested in medicine when I was in grammar school when I got sick. And it was nothing big. It was just had abdominal pain and turned out to be appendix. And went to the hospital and just kind of caught my eye and got interested in it from there. And I just started volunteering shortly after that and spent a lot of time in the emergency room, and then just pushed on forward from there. The thing I like best about being a cardiologist is that cardiology is constantly progressing with technology. We're constantly looking at things to make things better than what we did before. I think cardiology is probably has always trying to be on the cutting edge with technology and treatments. And one of the things about being a cardiologist is that you have to really think quick, make decisions quick, because sometimes moments count, which can obviously alter, someone's, life dramatically. I think that the best moments that you have as a doctor when you walk into a room and you see a patient and the family's there and they're concerned and you see that patient and you feel that you can really make a difference with their care, and then seeing them get better and then seeing them go home, and then the continue to seeing them in the office to continue to do well. So it's that it's a challenge, kind of figure out what's going on and then try to make them better. And then when you see the patients feeling better and the family feeling better and everybody getting back to their normal life, it's quite fulfilling. When you're sick, you like to see somebody who's a familiar face, and especially if you've been seeing them for a long time. I have patients that still remember me when I showed up 20 years ago. They said, "Oh, you were my doctor before you went to Dartmouth," and I was like, sometimes I remember, sometimes I don't. So I feel that's a big, important piece of medicine, not just cardiology, that is lost. That the continuity of care of the patient is extremely important because it matters going forward. Outside the hospital, I have 4 kids, and my kids, one of the nice things about practicing in Rutland as opposed to if I would have stayed back in New Jersey is that my kids went to grammar school and high school for most parts, right within a mile or 2 from here. So I was able to, when I was back here in Rutland, to get to be involved in a lot of their school activities, whether it be the plays or recitals, sports, so it was quite, happy that I was able to do that. Though I no longer ski, I do like playing out in the snow. I'm snowmobile, 4-wheel, jet skiing, so that still holds my interest. I like the ability to know the staff, know the physicians, and build a relationship with the staff and the physicians, and not feel that you're walking the halls and you don't know anybody. In the morning you say good morning to everybody you see, and it kind of feels like family.